Hadiel is an African digital health insurtech and SaaS platform that aggregates all health insurance ecosystem stakeholders, the payer, user and caregiver. Hadiel empowers every player to make empirical and informed decisions. With a data-driven platform, all stakeholders can proactively mitigate risk, improve quality outcomes and financially optimize decisions. They are on a mission to accelerate insurance inclusion in Africa via technology and data science. As a pan-African company, Hadiel has commenced operations in Nigeria with a future rollout to other African countries, where they want to achieve universal health coverage, including financial risk protection, access to essential healthcare services, and access to safe, effective, and affordable essential medicines and vaccines for all. Next on DIA Primetime, Hadiel. Welcome, Tunde. Good to have you on DIA Primetime. Can you introduce yourself and Hadiel?
Good morning, distinguished ladies and gentlemen. It's a pleasure to be here at the DIA 2020 convention. My name is Tunde, and I'll be talking to you about our solution today, which is called Hadiel. Well, a little bit about my background. I'm foundationally a medical doctor, but I found myself to be on the insurance side of the fence for the past 16 years. Hence, I like to describe my Ikigai as having found the connection between insurance, technology, and deepening penetration. Now, while we delve straight into it, what is Hadiel? Hadiel is that software as a service platform that is aggregating all the stakeholders within the health insurance ecosystem, being the payer, the service provider, and then the end user, to churn out health trends, disease patterns, and consumer behavioral health to give that predictive element to the stakeholders in the ecosystem. And so what Hadiel is basically doing is it's decentralizing everything that has to do with risk by bringing in a predictive component onto the fore. Now, a little bit of contextual background about the problem. Traditionally, insurance is taken as a game of probabilities and assumptions. And up until about 5 years ago, you will find situations whereby terms like data science, data analytics, machine learning were all buzzwords. Fast forward the hand of time, what we've come to realize today is that data science and data particularly is doing a lot of heavy lifting when it comes to providing solutions. And so what Hadiel is actually doing is removing that probability from the insurance equation and replacing it with precision. Without further ado, when you look at the whole gamut of what happens in insurance, what we found out is that, number one, you're not able to foresee that risk without wedging it on some form of assumption. But when we bring out a scenario, look at this possibility and just take a pause for that and let it sink in. Imagine if you were able to predetermine a subscription that was going to go bad. Just let that thought sink in. Also imagine if you were going to be able to prevent anybody from coming onto your product or your solution just by being able to risk profile them. That is exactly what we're trying to do. We're trying to demystify that probability that comes usually with the normal chain of events, and we're replacing that precision in the cycle of events. Now, at the end of the day, what we're going to be able to do, like I said earlier, our platform is aggregating all the stakeholders within the insurance ecosystem, and then what happens is you're bringing to the fore that element that will help you to mitigate risk and give you a platform to be able to decipher, number one, micro solutions and micro products, number two, get those disease trends and patterns upfront before they actually come onto your subscription platform. And then number three, monitor consumer behavioral health patterns, which will essentially help you to be a more profitable organization. That said, one of the things that you have to be at the back of the mind is it's interesting how insurtechs are tackling different parts of the insurance value chain. We like to say we're focusing particularly on the risk profiling side. And why the risk profiling side? We're focusing on the risk profiling side because we're able to remove that element which you're most concerned about as an insurer. And we're going to be walking you through some of the features of our platform and how it's going to be able to empower you to get some level of understanding for the disease patterns within your health subscribers that come onto your platform as an insurer. And so while we understand that you definitely have interesting departments in your actuary and then your ICT, what we're basically trying to do is to augment and complement that, because research has particularly shown that within the next 15 years, underwriters are going to be very, very dependent on the use of artificial intelligence and machine learning to augment what it is that they're doing. And so I'm going to show you certain features that would help in assisting, for instance, number one, you being able to show your subscribers how they can come onto your platform with a microelectronic health record. That's number one. How chatbots can help you communicate easily with your subscribers. And then particularly for you as the insurer, how you're going to be able to see some level of BI, business intelligence, and analytics on your dashboard, which is, of course, encrypted end-to-end and is only accessible by you to get the information that you require, if you subscribe to Hadiel. And so I'll delve right quickly into just showing you what our solution looks like by giving you a sort of demo. So I'm going to tell you a little bit about how we're decentralizing this actuary function, because one of the major things that we're trying to put to the fore is how you eliminate risk. We're de-risking with our platform and assisting insurers traditionally to layer onto what they currently have existing in their actuary and their ICT functions, and bring that level of precision with our platform. And so what we're doing in summary is we're increasing underwriting efficiencies and capabilities. We're giving you a more finessed approach as to pricing, and we're also giving you a more finessed approach as to creating micro benefits, bespoke benefits for your health insurance solutions and products to your end users. And some of the features that we're going to be showing you along the lines of this presentation is the capability to, for instance, number one, have microelectronic health records embedded for your subscribers, and then you as the insurer, the capability to be able to check utilizations per time when it comes to the disease trends and utilizations for subscribers on your platform, and when it also comes to the financial utilization, which has been used in the past for your subscribers. What the combination of those two things do is to help you bring some level of prediction as to what the consumer behavioral health patterns would be for future subscribers and existing subscribers. And so I will move forward to actually showing you a little bit of how the platform works. So as I mentioned to you earlier, one of the things that we'd like to show you is the capabilities of the platform. When you get the platform and you're logged in, some of the certain features that you see, if you go to the left side of the tab, right, what you essentially see is you see a drop-down menu. And then when you scroll down and you click on reports, it comes down with encounters. When you click on encounters, you see a certain variety of information, and the first thing you see is the encounters dashboard. Essentially, when you click on this, what happens is it shows you a myriad of things that have happened within a certain period of time. You can see information that is relating to your encounters, your disease patterns and trends, drugs, investigations, and the kind of facilities which your subscribers have visited over time. And so what the platform is essentially doing is it's shifting information from that level of granular, macro information to the level of granular information where you can take different information that you require based on the intervals that work for you as an insurer per time. So it goes without saying, when you click on the encounter button, generally what first you see is it gives you an overview of what has happened within a certain period which you would have clicked on. Now, in terms of the encounters, the certain areas that are covered relating to outpatient utilization, inpatient utilization, secondary care like optical and dental, orthopedic care, and all sorts of information that you require at a glance. When you also want to deep dive and go further down, when you click on the second button that has the disease patterns and trends, what you see is the level of disease patterns and trends that has been used within a certain period of time. So for instance, you're able to see information about your staff, about your subscribers who have been able to go through a certain period of their subscription, seeing the different kinds of non-communicable diseases and chronic conditions which they have been predisposed to within a certain period of time. Furthermore, if you click on the other buttons, so for instance, if you clicked on the hospitals, what happens is it's able to give you a bird's eye view with our business intelligence platform, what has happened in terms of the most visited clinics, hospitals, or service providers within a certain period of time. So in summary, As of today, we've been able to decentralize this information and data on a micro and granular level to our existing clientele. And we look forward to doing this with you on a ubiquitous level. Thank you very much indeed for listening to me. We'll be happy to take more questions and queries at your convenience. Thank you.
Thanks again, Tunde. Great having you and Hadiel at DIA Primetime.